Welcome guys. So it's my pleasure to introduce INSS rank to Dr. Devender Jain. So welcome Devender.
Thank you so much, sir.
Devender is an MBBS graduate from AIMS Raipur and an MD graduate where he's just finishing his exam from AIMS New Delhi. He's got secured rank 2 in the latest INSS exams. We're going to have a look at his strategy, his mode of preparation, how he approached the exams, how many MCQs he attempted, and possibly what are his future career prospects. So, welcome, Devinder. Welcome to the show.
Thank you so much, sir.
So, Devinder, again, why did you choose cardiology as your super specialty? So, again,
Uh,
INSS is not like the NEET SS, where
yes,
it's a general paper. You have to specifically study for a given subject. You have to choose a subject beforehand. So you chose cardiology. Why cardiology?
in the starting of MBBS only, like in the third year, I had in my mind that I have to pursue cardiology, and for that reason only, from that from that start, I had one dream that I will be becoming a cardiologist in my near future. So I took MD just for this reason only. But in the MD medicine, after getting into this MD, is I was exposed to other specialties also. So I had a dream of that gastroenterology is also a good branch. But later on, is in the third year, final year, I decided that I will do MD cardiology only, DM cardiology only. So
People get a calling for the subject at different times in their life. You got your calling during your second year MBBS. So
yes,
for
sir.
me also, I thought I chose cardiology also in my second year MBBS. So any particular reasons why you chose cardiology? Now every subject has its own charm. Just as cardiology, why did you specifically choose cardiology? Any particular reason for that?
Like at that time, like I had a few family members who had recently had heart attack, and in those putting a stent had reversed the course. And at that time, I felt that it is the most fascinating that just have one hour procedure and you will be fine, and you can save so many lives. So that was the main reason like I chose cardiology.
So again, you chose cardiology probably for the quick results which it offers. So how
Yes.
did you approach your preparation for cardiology? Like when did you start your preparation, and what were your resources, and how was
Yes,
your overall plan regarding how to tackle these exams?
yes, sir. I entered MD medicine just with the help of Marrow only. So in the DM also, I started preparing from Marrow only. So in the third semester, I started seeing the videos and I made my notes. And at that time, I also started doing my MCQs. But in between, as I was also had a thing that I can do gastroenterology, so I was also distracted. And in the final year, and around in the month of March, I was fully focused that I have to do cardiology only. So at that time, again restarted my notes, and I read my notes twice and thrice. And I didn't had many much time to study Brownwald, and I only spent around 1 or 2 months reading Brownwald. So I completed only few chapters, like 4 or 5 chapters I completed from Brownwald, which were from mainly in the CID part, and one or two chapters for exercise testing. So in the last, I had talked with my seniors from cardiology. So they were telling that the tables from Brownwald are very much important, and I now I also have same opinion. And for me that preparing like reading all the Brownwald is not able to, I cannot do that. So I had one thing that first of all, first I will take 100 most important tables. So from Brownwald I took 100 tables, and I in my tab I collected all those 100 tables, important tables. I started reading those tables, and after completing those 100 tables, I will do another set of 100 tables, which will be less important than other 100 tables. So this way, I completed the Brownwell most important tables only. So when I into retrospect that how it had helped me, that around 15 to 20 questions were from those tables only. So it was a great booster for me. And apart from this, I had read all the latest guidelines, like 2023 ESC guideline and 2024 ESC guideline I have read. As there were some changes were there, and I feel two or three questions were directly from there, like only those statements were there from the latest CSC guidelines. So that has also helped me. One thing which I did, which was not help me in interview and as well as in the exam, like that was I read around like 200 300 trials names and like whatever the conclusion in that. So it was a better, like it boosted my confidence, but it was not exactly helpful for me. Like it was not asked in any like theory paper or in the practical, but yes, it gave me a confidence that yeah, I know much many stuff.
So interesting approach regarding dividing brown ball into tables and learning it. So each one has its own approach. But firstly, do you think that is it absolutely required that you need to prepare for a super specialty level, or is basic, like if you have done your MD well and you have read Harrison, is that sufficient for your INSS, or do you need to go a step further?
No sir, I feel we have to go one step ahead, because
Have to.
yes sir, this is not just an Harrison based questions. Like there are a few questions which cannot be just solved by reading only Harrison, or even I feel ki some questions were there which were based on latest ESC updates. So uh, I feel ki doing this, it will be
You have to
helpful.
go a step further. That's what you feel.
So if you
So
want
you read, yeah.
5 or top 10 rank, then it is necessary. Otherwise, getting rank in 15 top 15 or 20 top 20, you can get it by reading notes religiously. You can get that good rank.
Now, what I'm basically saying is, if you read Harrison alone, is
Yes, sir.
that enough?
No, sir. No,
Like,
sir.
not enough. So you need to go a step further.
Yes, sir.
So you read Braunwald's tables. Were you able? Because it's you have to learn a texture background. So you have to learn the foundation of the chapter. So if you are reading just Braunwald tables, were you able to understand them?
No, sir. I had background knowledge that I have read two, three times notes of your like Mero notes. So I had background knowledge,
You have
and
the lectures also, right?
yes, sir. So I have read all the notes, and I have watched two, three times the videos. So I had a background knowledge. I just had a few like indications and contraindications, and like mostly something like cutoff based. So those we have to remember for the exam only. So those things I have read from Brownwald tables.
Braunwald. Did you read any of the congenital heart disease books like Pearl of Park?
No, no, sir. I have not read. I have just watched your videos only, sir. And like
Because
all.
in our time we used to read all those things, Pearl of Park and all those things, and try to make a sense of it.
No, sir. Like actually, we have few very friendly friendly seniors in cardiology. So if we had some doubt, we asked some questions from them, and they used to teach us also. So Dr. Aviskar is there in a final DM cardiology student. So he used to teach us, like whenever we have some like free time, we ask the sir that sir, please take a class, and he is very nice. So he used to take our classes, and like few like practical approach to like teaching us. So it was very helpful.
Did you was your aim consistently the INSS, or were you also planning to write NEET SS? I know NEET SS is a bit late this year. Was your aim purely INSS, or did you have a NEET SS in the back of your mind?
No, sir. I only wanted to do cardiology from either from AIMS Delhi or from PGI. So there were no second thought of me like doing.
So you're purely INSS focused.
Yes, sir. Yes, sir.
Yeah, that's nice. So
Yes.
when you're planning to do institutes, it's always better to focus on this exam. Previously, the NEET SS and INSS both where a cardiology had a cardiology specialty paper. Right now, these are two different exams. So if you're planning for the INSS, I think you can you can focus especially on the INSS. because it's purely a subspecialty focused paper with an additional background on medicine. So, how were the cardiology questions? How did you feel the cardiology questions level was? First of
Uh,
all, how many questions did you attempt in the exam?
Sir, I attended all the questions, and I
So,
feel
ET.
yes, sir. Out of 80 out of 80, I have attended all the questions. Sir, I feel this time there were very few questions were there from congenital heart disease, and like I focused very much from like on congenital heart disease part, and also on electrophysiology part. So those questions were very much less is this time, and mostly the questions were from pregnancy and valvular heart disease. So this time entire paper it seems like these
There are a
two
lot of questions from exercise ECG also.
exercises is also, sir. Yes, sir. Yeah,
So,
yes. I
yeah.
didn't read table one table which was there. Like I skipped that table key. It won't be asked like at what level of physical exercise level it will be achieved. So that was
The last time there were a lot of questions on electrophysiology, so people expected that they
yes,
are
sir.
going to focus more towards electrophysiology. It
I
was
watched those
also, yeah,
which were
exactly. So,
3 days before the exam. So I watched those videos. I made the notes also. But yeah, it was
and
it.
it happens. Na? Some last time since they asked, it was a shock for everyone.
Yes, sir.
Right now, it is a relatively standard paper. How do you feel the level of the paper was? High standard or a low standard or medium standard?
I feel it was low standard, and I committed very mistakes, very few mistakes. So I felt that this time it won't be possible for me, and interview was also not so great. So I felt it won't be a, good rank this time. So
So, how
I
many
was
questions did you attempt?
sir 80
So,
out
you
of 80.
attempted 80 out of 80. How many questions did you get right?
Uh, Approximately, sir, I think I got 18 questions, 17 or 18 question rights. There's 17 or 18 question wrong.
Around 62.
Yes, sir,
62
60.
questions you got right. So, again, one thing consistently is that attempt maximum number of questions, attempt at least at around 75 questions. So, that will give you, because all the toppers consistently attempt around more than 75 questions. Because you do get questions wrong no matter how good you are. So, consistently attempt at least 75 questions out of 80. Okay, how was the interview for you? So, how many questions were asked?
Yes,
Like,
sir.
what were the questions which were asked? Any idea regarding those?
Yes, sir. I had four questions. One on my thesis,
You
and
had only four questions, right?
yes, sir, only four
Four
questions.
questions.
One was on a patient who is presented with chest pain, and patient was had STEMI. So how do you approach through this patient? And one question was on heart failure, and one question was on physical findings and clinical findings of MR. So
So, basically, random questions.
yes, sir, all the random questions.
And you had a question on your thesis also, right?
Yes, sir.
So I think consistently what we have seen is that even in our pre-interview session, we said that basically there's no point in studying. They
Yes,
ask
sir.
you a few random questions, and one of those questions is going to be on your thesis. So
Yes,
this time also it's only four questions which are asked.
yes, sir.
Basically, it means that your exam is your MCQ exam is the most important part.
Yes,
And by the time this is probably secondary, just to
sir.
filter out among candidates. So, any
Yes.
good to know regarding that. Okay, how was your experience with Marrow? How was the content, the lectures, the grant test, the MCQ bank? You would have finished all those. What is your opinion regarding those?
Sir, like I am the consistent student of Marrow. Like I did MD entirely from like preparation for MD was from like entirely from Marrow only. I watched neurology, gastroenterology also from this Marrow. And for cardiology parts, sir, it was very nicely written, and all the topics has been covered, sir. What I feel MCQs, I couldn't complete all the MCQs, but yes, around 60 to 70% of part I have completed, sir. So all the GTs and QBank part is very nicely written, sir.
Did you
Mainly,
attend the grant test?
yes, sir, I have attended grant test, but the rank was not so great in this. But yes,
Okay.
the level of grant test is very much high. There are very much. I feel there are theoretical questions. In the final NISS, I feel there were very few one-liners are there. Mainly concept-based questions were there.
So, how do you feel? What would you advise your, juniors? Now, your part is done. You're probably, I guess, going to stay back in your home MD college. What
Yes, sir.
would be your advice for the, next generation? Like,
Yes.
one is when are they supposed to start studying? Okay, how do they approach their studies with respect to the INSS? Since you're basically prepared only for the INSS, so when do you
Yes.
start study? How do you approach your study? Maybe how do you approach your exams? You can just give a message for the next generation.
So I would say कि whenever you start, there is nothing late. Nothing can be said that it is the late. So like for me, my part, I really started only after entering into the sixth sem. Like that is in July or August part. So it was, I felt that I won't be able to make this time. So but yes, after like, so you can do, there is nothing that ki this much time is enough or this much time of is less. It is all upon you, like how much effort you are putting in the preparation. I feel around 3 to 6 months of preparation is enough. And most important part is the notes. And you need to have a like good sound of your notes, like 2 3 times or 3 to 4 times notes. Revision of notes is essential. And apart from this, Brownwell tables are very much important, and latest guidelines. If you can read, it is well and good. Otherwise, even if you can't complete those guidelines, it is okay. So like this I think this much summarizes the my preparation, and this
So,
is.
like you gave a lot of importance to notes. Is it important that you create your own notes, or will it be useful if you have the under the MD students have notes? Marrow has given them individual notes for the subject. Those are preparing from MBBS to MD. So,
Yes.
is notes if available would be good for you, or are we supposed to prepare our own notes?
Sir, it will be better, like because in MD we don't have much time to make our own note. So it will be better if we have a printed notes or
You would like prepared notes, right?
yes, sir.
Yeah, prepared notes. But on top of that, you can add all the important points.
Yes, sir.
So how long did it take you to watch all the videos? Did you watch the videos once or more than once?
Sir, few topics I have watched more than 2 times or more than 3 times also, like congenital
Okay.
part.
So how long did it take you to read all the videos? I mean, learn all the videos.
Sir, I completed most of the videos in my third semester, and around it took me around 3 6 months. Like whenever I get to free time, and I would have watched my videos. So
Basically, among your hectic schedule, whenever you got your time, you watch the videos. So how
yes,
useful is the videos? You can not only comment on cardiology. How useful is the overall platform, cardio, neuro, nephro, gastro, and all those things with respect to your clinic? Suppose you're a person who's not planning for a DM, who wants to
yes,
settle down only with MD medicine, and that is becoming a rarity these days. So if you're planning only for an MD medicine and you want to practice medicine only, how good is the videos for the practicing MD medicine as well as the for your preparation for your university exams and practicals?
yes. Like Mero has given an extra edge to my preparation. Like for others, like in the final MD exam also, like we didn't had much time to read the textbook. So like we just opened the notes and we just read the notes. So even like for some topics like ABPA in the like pulmonary part, like there are selected topics were there. So we have just watched the videos and just read the notes. So like it will like complete we can complete a subject in 1 or 2 days, while from reading from the textbook it will take around 10 to 15 days at least. So it could cut so down all that like time. And by that time, like in the MD, in the preparation, in the during the MD also we don't have much time. So watching with the videos and having the notes in our mobile, it was very much helpful for day to
I
day.
think one advantage which all of you guys have is you have excellent resources, and that cuts short a lot of your preparation. Because if you start reading a book, it's very difficult. It'll
Yes,
at
sir.
least triple the amount of time you require to read a book. So I
Yes.
think all of you guys are lucky. You live in an age of information overload probably, and your biggest headache is actually to choose which resource. And I'm glad that you chose Marrow, and I'm glad that we got a chance to help you in your, securing your future and entering into your dream branch. First of all, congrats and wish you a wonderful career ahead. And hopefully, we get to meet soon in some cardiology conference or the other. So, thank you, Dr. Davinder. It's been a pleasure meeting you and wish you all the best in the future.
Thank you so much.